So, went into the doctor recently. I had a prostate exam, and when the doctor left, the nurse walked in and said the three words no man ever wants to hear. She said, "Who is that?"
I don't get it.
You get a better laugh than I do on that. I have a question for you guys. Your dad, who's 70 years old, has a heart attack. They come to you and say, it's going to cost $3 million to give your dad a new heart. You say, $3 million? And they said, yes, but the good news is you don't have to pay any of it. It will all be paid for by the government. Now, who amongst you would go ahead and authorize somebody else to pay $3 million so that your dad could live another couple years? Almost everybody in this room. Now, how many people would authorize it if the deductible was 10%? So you had to come up with $300,000. You couldn't borrow the money, it actually has to be cash. So you can only say yes on this if you have $300,000 in the bank right now and you're willing to spend it to give your dad an extra 5 years. So how many people would now pay $300,000 to give your dad? Okay, so now we're down to 3. So we were at about 7 and now we're down to 3. That illustrates the entire point of healthcare. When you're spending other people's money, you're more likely to spend it. When you have to spend your own money, you find reasons to maybe spend it on the grandkids, or maybe spend it on the education of the next generation, or maybe go adopt 100 kids who are going to starve next week down in Africa for the same $300,000. There are ways to benefit our society that may not be the best way of throwing good money after a non-productive guy who you love, who you'd love to live an extra 10 years, but really isn't going to contribute to the tax benefit of society or anything like that. Those are tough decisions, very tough decisions. But who should be making those decisions? Should the government be making them for you, or should you be making them for yourself? Should your family be looking at your own finances and deciding how you want to spend that money? That is the difference, the major difference between the two plans. The Republican plan wants to put more power in decision-making ability by requiring more of your own money be spent for healthcare, whether it's a higher deductible or whether it's paying premiums that are based on actual insurance company estimates of how likely you are to be in an accident. The Democratic plan doesn't like to discriminate against people. The Democratic plan doesn't want to discriminate against people based on age, based on promiscuity, based on zip code, based on race, based on age, or any of the things that used to be valid factors that insurance companies took into account when they decided your health care. Let me give you another example. Should a nun be paying the same premium for health care as a skydiving heroin addict who just got released from jail? Now, who is most likely to end up dead? The heroin addict with the criminal record who is skydiving, or the nun who just drives back and forth to church every week? Under Obamacare, they are both going to have the exact same premium. And that's why the premiums have been skyrocketing. Under the health care plan before Obamacare, one would be paying 5 times as much as the other. And under RyanCare, which has been recently proposed, they will actually allow a difference in premium of up to 5 times. Because age was not a factor that was allowed, sexual activity, addiction, pre-existing conditions, none of that was allowed to be considered by insurance companies in setting premiums under the Affordable Care Act. RyanCare will now say, well, we're going to let you take those factors into account, and really a 70-year-old is more likely to have a heart attack than a 24-year-old. So shouldn't a 70-year-old be paying a higher premium? Under Obamacare or Affordable Care Act, the answer was no, because that was ageism. Under RyanCare, you can have up to a 5-time differential, and previous to that, it could have even been more. So let me go and talk about some of the other issues that we are discussing nowadays when we discuss healthcare. it's very important that people be able to get health care regardless of pre-existing conditions. Everyone loves to say that. But I recently had an insurance claim. I recently had an insurance claim where I've been paying 15 years worth of premiums, and then my boat sank. So I called my company and I said, my boat sank. And they still came out and fought with me and tried to find a way not to pay the $60,000 it was going to cost me to fix my boat. But at least I had 15 years worth of payments that I had made in good faith. I hadn't made any errors that they could point to that would allow them to deny coverage. And I not so subtly told them I'm more than happy to sue them, that this wasn't my first rodeo when it came to getting insurance claims. And lo and behold, I got paid the $60,000 that I was due. Now, that could have been a pre-existing condition. What if I hadn't paid 15 years worth of premiums? I looked out my window and saw that my boat sank. And I called up my insurance company and said, I want to get insurance for my $60,000 boat. And they came out and says, it's already sunk. Why should we insure something that's already sunk? And I said, it's a pre-existing condition. You have to give me insurance. Does that make any sense? No. And that's why Obamacare has a death spiral of costs, because who wants to actually buy expensive insurance when they don't have to, if they can force you to take them under pre-existing insurance? Now, Obamacare got around that a little bit by saying, well, we're going to have an individual mandate. We're going to force you to buy. It's the first time ever under the Constitution that we're forcing people to buy a commercial product. And we've never been able to force people to buy stuff before and give them penalties for not buying it, but it got labeled a tax. So because it got labeled by the Supreme Court as a tax, they therefore said it was constitutional. But if you were having to buy a house, or if you were having to buy a car that was made by General Motors, because now the government and the union owns most of General Motors, that may not have passed muster, because that's more of a commodity and can't really be characterized as a tax. But that's something that the conservatives have had an issue with in regards to the individual mandate. But even with the individual mandate and even with the penalties, it's not enough to support the huge cost overruns that come from people who say, fine, I will pay the penalty each year for 15 years, because the penalty is a lot less than the premium. And then when my boat sinks, I'll just go file right then and there for a $60,000 insurance policy, and I will have paid half of what my normal premiums would have cost over that period of time. So we got to fix this. We got to fix it somehow. Let me talk about some other things that unfortunately are in the Affordable Care Act and why it's not making a lot of sense. There's a state board in every single state, and the state boards get to determine the rates that insurance companies are allowed to charge. Now, if an insurance company comes in and negotiates really well with a hospital and really well with the physicians and says, we know that you're inflating your bill twice as much as you expect to get, because insurance companies always pay half of what you charge. So we know you're gaming the system, and we're going to game you back and only pay half of it. And so they do but this time we're not paying half, we're paying 40%. So the insurance company ends up making extra money. According to the Obamacare plan, they have to refund that money to all of their customers at the end of the year if they make anything more than a predetermined 8% rate of return on their assets. So what is the benefit for working for a company where the better and more efficient and more productive you are, you don't get a nicer car or a bigger salary or get to expand or invest more in your business? You have to shovel it on back to either your customers or to somebody else. It takes away the entire incentive for doing better. Where's the profit? There's no profit in it for doing better. Just like in a socialist system, if there's no profit in doing better, people they show up to work 6 hours a day instead of 8. They certainly don't come in on weekends. If you don't have some type of incentive to reward extra productivity, people just don't get productive. We can try and change that under RyanCare, and before RyanCare, we had a lot more market participation. But let me ask you one other question. I was talking to an attorney recently, and he said, Eric, what would you do if you want to go back to the old system before Obamacare? What would you do if somebody walks into the emergency room, they don't have insurance? Would you deny them care? That's a tough question. All of us are generally merciful people. we want to help people, and we think that the goal of our society should to have some type of a safety net in terms of minimal care for emergencies. So what's the answer to that question? Do you give that person the same level of care as somebody who's actually paying insurance? Or do you have a tiered level of care? Prior to Obamacare, there was a tiered level of care. They would figure out if you didn't have insurance, then you'd have to wait a little bit longer in the emergency room. You wouldn't get as many prescription pills, you'd get all generic. You wouldn't perhaps get the best doctors, you'd get some of the people who are just training, who are interns, so that they can make their mistakes on you. It sounds a little bit, sardonic, but in fact it was a tiered care. So the people who actually paid got better care. They got single rooms instead of rooms with 4 people in them. They got the better doctors, the ones less likely to make mistakes. That system was working, but it also gave us some of the highest, most expensive care in the world. I believe in the market and I believe in the free market, but I did a comparison of the costs for our society and what it costs under the old system versus a single paying system off in Europe. It's actually cheaper in Europe. The cost per person is about half of what we spend per person here in America on medical care. Now that doesn't make me pro the European plan. I think we can, but there's obviously fat or non-productivity or some type of problem that we're not addressing in our country if you can get decent, good care somewhere else and you can't get it here without paying twice as much. So what are some of the other solutions that we can have? Well, I talked about some proper risk assessment by insurance companies, market competition, allowing insurance companies to compete not just in that state, but throughout the country, as opposed to trying to please a state board and then having to give up all the profits if they do too good of a job. Take away all of that regulation, allow them to compete across the country. Health savings accounts, that's the crown jewel of this plan that's being promoted by RyanCare. Let people have control over their own money and they're more likely to make good decisions with it. I started this whole thing off saying how many people would spend money that's not theirs. Everyone loves to spend other people's money, but if you have to spend some of your own money, then you start making some of those tough decisions, and those are the tough decisions that unfortunately our society is going to have to get better at making. Fellow Toastmasters.